Hi, I'm Dr. Chapple. I'm an endovascular neurosurgeon who also specializes in minimally invasive spine surgery here at ANS, which is Atlantic Neurosurgical Specialists. So today, I'm here to talk about one of my patients who has two very distinct pathologies. I just saw him in the office, and I just want to tell you a little bit about his story. So he's a gentleman that had neck pain as well as headaches, and the workup showed that he has a herniated disc in his neck as well as an aneurysm in his brain. So what we decided to do was make a plan of how we could treat both things, not necessarily at the same time, but make a plan of how we could approach both things. So we started with a cerebral angiogram, which is a way that we look at the blood vessels of the head and neck. We were able to diagnose the aneurysm and figure out a treatment plan, which is going to be a pipeline stent. Now that stent requires anticoagulation prior to its placement, and so we couldn't do that up front because we also have this disc in his neck to consider and to treat. So we needed to do the open procedure on his neck, which we have completed, and he's here today for his follow-up appointment. He's doing quite well. We were able to do an anterior cervical discectomy infusion, taking out the disc and fixing his neck and taking away the pain that he had in his neck, in his back, and in his shoulders and arms. He has since undergone that procedure. He's healing well and feeling very good, and in a few more weeks, he'll be through that healing period of time, and we will then be able to address the aneurysm by using the pipeline stent. That stent requires anticoagulation prior to placement, which we'll do from an endovascular approach. And endovascular just means from the inside of the blood vessels. So we will do that, take care of his aneurysm. I'm quite happy with where we are right now, and more to come.